Hampton Roads Community Health Centers offers primary medical care to residents of all ages, as well as guidance in choosing and applying for public assistance and health coverage. But there's more. Please welcome Chief Medical Officer Dr. Catherine Christie, Behavioral Health Director Thorisha Hill, and Community Outreach and Enrollment Specialist Maravik Potter. All three work with the community health centers in different roles, but all of those roles are very important. The community health centers span several cities, including Norfolk, correct?
Yes, ma'am.
Yes. And what is the goal behind these community health centers?
The community health centers are actually a safety net network for patients who are underinsured, patients who have lack an ability to find health care. So we're trying to make health care more accessible and more affordable for the patients of Hampton Roads.
Okay. And what about the age ranges? Does it span all ages?
We see every patient, all ages, infants to geriatrics.
And do they come to these centers or do you come to them?
We do have a dental program where we actually have a dental van that goes out to the schools. So parents who aren't able to take their children in to see dentists can actually get dental preventative care on site at the school. We do also have some of our providers going to the elementary schools to do sports physicals and things like that. For our core preventative care and chronic care disease management, the patients are able to come to our Portsmouth site, and then we have 4 sites in the Norfolk area.
4 sites in the Norfolk area?
Yes.
Wow, okay. Well, that's good to know since we're talking about Norfolk here for the most part. And they can come there for all types of services. What are your focus areas?
We focus on the entire patient. We have acute care management, so patients don't necessarily have to go to the emergency room if they sprain their ankle or have an acute cough. Okay. We also do chronic care disease management as well as dental care, as I mentioned earlier.
Okay, you work with new mothers as well?
We do. We work with new mothers, we work with newborns, so we can take care of the entire family.
Okay, great. Well, it's good to know that this service is available. We'll have the number up on the screen throughout the interview. And when Thorisha Hill is the behavioral health director for the community health centers, and behavioral health is really starting to get a lot of attention, not only behaviors in general and the state of people's mental health, but just assistance or ways to coordinate care and address some of the issues that may not have been in the past. So I understand that the community health centers is doing something specifically in that area.
Yes, we are. We provide counseling services to the patients of our community health center.
So are they screened before coming in? How does that work? Maravik, perhaps that is your area.
Well, when a patient comes in for behavioral health or any type of medical, we as a community outreach enrollment specialist assist them with any type of health insurance program. We would do the non-financial part of the GAP, and Ms. Hill does the SMI screening, which she can elaborate more on the screening part.
Okay, and she mentions the GAP as it's a type of coverage for severe mental illness that has been allocated by the General Assembly to fund that in lieu of expanded Medicaid, excuse me, and that has become an important population to focus on.
It has.
But even beyond that, people who may have some other issues that can develop into something much worse are, of course, better off if they're caught early and treated early.
Yes, they are. And so back to your question about screening, we screen patients for depression when they come in. Oftentimes people suffer with depression when they have other illnesses.
And medications can also contribute to the way somebody feels.
That's correct. Yes, it can.
Right. So being able to determine whether the medications they're taking are doing good or otherwise, I guess, is an important aspect of it.
It is.
The behavioral health screenings is this an area that's been expanded in the centers?
It is an area that has been expanded over the past 2 years. The Affordable Health Care Act allowed centers like Hampton Roads Community Health Center to offer behavioral health services inside the center for our patients so that they can have access to behavioral health care easily.
Okay, which I imagine would be helpful if you're going there for something else to also have everything in one place, or at least in one of 4 places in Norfolk. But still, that you can go to some place, you know where you can go, and it doesn't have to be
Absolutely.
the result of something that could have been prevented and doesn't have to be an ER or an urgent care.
Absolutely. The whole point is integrative care, comprehensive integrative care. So you can do one-stop shopping. It's an integrated part of the visit. Initially, when the patient comes in, we actually do our mental health screenings, and we do warm handoffs actually to our mental health providers so that patients can meet them in the office with their primary care doctor, and it's an easy way to transition them into talking about mental health. Mental health affects chronic disease management. If you have a diabetic who's not feeling good about the diagnosis, they're not going to do what the doctor recommends, potentially. And so we have to address those concerns instead of just pushing medication, pushing pills, and also some of the other recommendations. Are there barriers to the patient being able to exercise or to eat healthy, nutritious meals? That's where our mental health services come in.
Yes, they provide a context for the patient so that they actually can understand how these things affect their quality of life.
Absolutely.
Yeah. Which is, of course, a great concept, and it's just wonderful that we have the opportunity to do it. Would you say that, do all patients get this opportunity to meet someone, or is it based on the assessment that you do upfront?
We do have structured assessments that the providers and the nurses do, but based on talking with the patient, every patient has the potential to have access to the behavioral health specialist.
Okay.
And even beyond seeing the doctor, patients can call in and say, I'd like to speak to a behavioral health specialist.
Wow.
The great thing is we actually have a new facility in iCare, which is in the Norfolk Community Service Board, another part of integrative care, where we're increasing access points, and patients who have mental health illnesses can also get primary care on site.
On site at the
Community Health Center.
Wonderful. So you really are being able to kind of pull people in from various pockets of the community that may not otherwise have been able to access these types of services. So it means a tremendous amount of work for you.
It does.
Yes. But are there plans for the future? What do you see?
The plans for the future are to continue to perform as a medical home for patients, do coordinated care so that the patient has a group of health professionals that surround them and help them navigate their health needs. That's the most important thing. I need patients to understand that they're also responsible, but we're here to support them.
Okay. Thank you, each of you, for sharing your insight into community health. It's so important, and great work. Thanks so much.
Awesome.
Thank you.
Norfolk is one of 3 communities in Virginia where African American women experience a high percentage of low birth weights, late-term miscarriages and infant deaths, and births to teenage mothers. The Loving Steps Healthy Start program provides a host of free services. Stay tuned. We'll be right back.